friends, welcome to Baby Heart India. We wish you all in advance all the peace, prosperity, and happiness of the upcoming new year, Ugadi and Ramadan. The topic for today's discussion is chest pain in children. Is it cardiac? Unfortunately, over the last few weeks, I had encountered nearly 10 to 15% of my OPD and ICU patients with chest pain. And every time the question asked was, Doctor, how will I know that this is cardiac? The heart is a pumping organ which is placed and safely protected within the thorax. So, a pain can be from the bones of the ribs, from the muscles, from the esophagus or the food pipe, from the airways, from many other structures. 95% of it will be non-cardiac. But then, 5% is cardiac. So how do I know? Usually, a cardiac chest pain occurs after exercise. So it may be after a PT class, it may be after some physical activity like excessive dancing, yoga, basketball, swimming, cricket. If the coach or you notice that the child is not feeling the same before and after the class, be careful. Cardiac chest pain may happen over hours and the child may have excessive sweating, the child may be breathing uncomfortably, the child may complain of giddiness, sometimes the child may faint, the pulse rate may not be palpable. If you put a pulse oximeter, it may show very high or very low heart rates. Now, why does chest pain, cardiac type, happen in children? The heart, as we know, has got 4 chambers, the 2 auricles or upper chambers and the 2 ventricles or the 2 lower chambers. It also has this red colored aorta or the body pipe and the blue colored pulmonary artery. Very importantly, you see these tiny tributaries which are actually the coronary arteries. A problem in any of them can cause chest pain in children. In another way, we can also say that the heart has 3 layers. The outermost layer is the pericardium. When there is any problem with the pericardium, which we call pericarditis, there is excruciating chest pain and the child wakes up crying from sleep, sits up, bends forward and asks for help. Myocarditis or the middle layer is the muscle of the heart. Viruses, bacteria, fungus, there are so many causes of myocarditis. The child may have chest pain, the child may have heart failure, the child may be lethargic, unable to perform like before, especially the physical activity. Endocardium is the innermost layer of the heart. That can also get affected due to any inflammation or infection. But what we are very worried about, especially after 2020, is the coronary arteries in children. The coronary arteries give blood to the heart. If they get blocked, the heart does not receive blood. If heart does not receive blood, nobody gets the blood. So that will cause immediate heart attack. The most common causes of coronary artery problems in children are: number 1, abnormal origin; number 2, Kawasaki disease, which can be due to fever, red rash, red eyes, red tongue. Please refer to our video on Kawasaki disease. I would like to alert all of you to the emergence of childhood obesity, almost like an epidemic, the use of junk food, the use of excessive screen time, a sedentary lifestyle, too much mental stress can cause damage to the endothelium, it can cause the cholesterol plaques, it can cause a clot and block off the coronary arteries. So what happens? What's the usual scenario? That imagine this to be a small child. This child is keeping on crying and we do not know why. As a parent, I am not finding any cause. I just know that the child is crying. So what should I do? I should immediately go to a healthcare specialist for children. Children cannot communicate, so when there is a very fast heartbeat, for example, if my normal heartbeat varies between 60 to 100, but my heart starts beating at 120, 130, 180, 200, I will definitely feel a severe chest pain or palpitation. Children will not be able to tell palpitation. They will tell you, Mama or Papa, I have chest pain. Something, very wrong in my heart. Please do not ignore it, as sometimes the child may deteriorate into sudden cardiac arrest. So what do I do when a child with chest pain comes to me in my cardiology clinic? The first thing is I should examine the child. I should see all the pulses. I should put my stethoscope and hear the child. I should see the tummy. Is there any acidity? I should see the lymph nodes, eyes, basically a head-to-toe examination. Very important to get all the four-limb blood pressure, the temperature of the legs, the pulses in the legs, the pulses in the hand, and there are different other modalities. A good clinical examination often tells us that it is cardiac or non-cardiac. Next, I would ask for an ECG. The child lies down, we place an ECG, and in 3 to 5 minutes, we will know whether coronary arteries are blocked, what is the heart rate, what is the rhythm, is everything fine. If required, next we decide whether we need an echocardiography. In echo, we not only see the outer structure of the heart, but we also see the inner layers, the cavities, the valves, the regurgitations, that means the leakages, any obstructions, the pulmonary artery pressure, any fluid or water or blood or pus around the heart, and overall also the lungs and the surrounding structures. So dear parents, for today, what we would like to tell from Team Baby Heart India is chest pain in children should be evaluated medically. If you are referred to a cardiologist, please do not be afraid. Let the cardiologist decide what is the cause. Most of them are treatable, and a healthy lifestyle with proper rest, food, sleep, exercise, mental relaxation, meditation, avoidance of substance abuse, avoidance of mental stress. In fact, avoidance of screen time. Cut down the screen time to as low as possible. Let's see. I'm very sure that India will have the honor of raising children into healthy young adults, and lose its reputation as the cardiac capital of the world. Namaste, Adab, and goodbye, India.